Hello and welcome to Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan.
This is the show where we want you to consider and then reconsider what you know of the news of the day. Now, a couple of hours ago, that hotly anticipated National Security Council meeting announced that they will be announcing tomorrow the tightening of MCO 3.0, which will include additional economic and social restrictions. Now, what impact will this so-called full-scale lockdown have on the ongoing vaccination process and more widely on our medical ecosystem as a whole for the care of both COVID and non-COVID illnesses? Let's focus on the vaccination program first. Joining us on the show, Datuk Chevy Beh. He's the founder of the health tech company BookDoc. Now, BookDoc is one of the operators of the vaccination stations at the WTC AstraZeneca Vaccination Center in KL. Chevy, welcome to the show. Thank you so much for joining us on the show tonight. I understand you've had a long day at WTC, but perhaps you could begin our conversation tonight by helping us understand a little bit better the role that BookDoc plays in the National COVID-19 immunization program.
So we are the administrator and the coordinator. So basically, we are given a task where every day X amount of thousands of people will come and do the vaccine. Our job is to verify, to make sure they are registered, number one. Number two, then after that, we go through the whole flow, right? So to check whether the health condition allows them to do the vaccine. Then after that, we're going to do the jab for them and subsequently observe the individual for 15, 20 minutes to ensure that there are no side effects and they're okay before they can leave the place. And the whole process will take about 30 to 35 minutes. Yeah, so that's our role and responsibility as we speak.
Right, Chevy, I understand that the two other stations, and I was lucky enough actually to be at your station at WTC, that those are run by different companies. Could you help us understand the rationale behind having different companies run different stations at the same venue?
Yeah, so I think everyone has what you call capacity constraints. I think initially the government wanted to roll out to all the GPs, but they wanted a fee of like 25 ringgit, if I understand correctly. But the government was only willing to do 14 ringgit. So if you are charging 25, sorry, you are out of the race. So these are the 4 or 5 hungry companies who are willing to do it at a rate, at a CSR rate, I would say, right? Because 14 ringgit, you don't really make much because you have to mobilize the whole workforce. Just like us, as a company as a whole, we have to mobilize about 60 staff to be on ground. And it's 9 to 9, not 9 a.m. to 9 to 5 p.m., but 9 a.m. to 9 p.m. So it's really draining and you have to pay the staff OT, etc. So it becomes commercially not viable for all companies to enjoy and go through this thing.
So can I ask you, Chevy, then, given your capacity constraints, are you concerned that perhaps a tighter lockdown, like the one that we're anticipating tomorrow, could that impact the vaccination process?
No, I think not so much. I think the overall thing has been very well received by people. People have been coming up and wanting to take the vaccine. Unlike the first phase with Pfizer, I think the take-up rate wasn't that great. But now for AstraZeneca, I've seen so many C-suites running GLC, MNC, and their senior management coming up and say, hey, I want to do the vaccine. I didn't see this in the first phase. So, and these people are
what
educated.
about your operations? What about BookDoc operations, your operations, Chevy? I'm happy to hear that registrations and take-up is increasing. But in terms of your capacity and your operations, are you worried about an impact?
No, every day we are ramping up. We are looking closely, dynamically, not static, that how many volume. So when we first started, just to share with you, was 1,200 people that we screened. And after that, there were about 5-6 days, there was only about 800. And subsequently, for the past few days, our capacity has ramped up to almost 3,000 a day. So now
Chevy,
the government
I want to ask you about the long-term government targets, right? Your company, the other companies involved, now located largely in the Klang Valley and in Selangor. But what about scaling up to a national level? How is that going to happen? And does it mean for your company hiring more people, training more people? What's going to be the landscape like?
Yeah, I think everything has to be planned systematically. Got to be like ad hoc, right? So the first phase, we have 288,800 vaccines, right? So now the phase 2, they were supposed to get 1 million, and I think they gotten like 1.1 million to be rolled out by June. So after that, then in July, I think the government is procuring another 10 million dosages. So with another 10 billion, then you can go to places like Penang, Kuching, Malacca, Johor. So there's a nationwide rollout plan. But for now, this is also a good testing ground. And Selangor, as you know, is bulk of 80% of the business activity. Majority of the population also live in Klang Valley, right? So I think this is a good testing site and a launching pad.
Can I ask you, Chevy, what lessons you've learned in the short time that you've been doing this? I know it's an evolving process, but again, there have been some missteps, some stumbles. In the early days, there were challenges with overcrowding and crowd management. Recently, we heard that there's now investigation looking into 2 incidents of recipients being administered lower doses of the vaccine than the required amount. I mean, what kind of challenges have you had to tweak your operations to?
I mean, there are a lot of tweaking and a lot of challenges, I'm not going to lie, right? So, number one, when we went in there, we put 24 doctors, right? So, I think 24 doctors is a bit overkill because you take like you're using basically a nuclear bomb to clear an ant, so it doesn't make sense. So, we have to right-size it that, okay, doctor, your job is to do the consultation and the jab. So, we only needed about 10. But the first day, we had 24 of them. Then we actually need more nurses to do the jabs instead of doctors doing the jabs. Then the consultation, it can be done by the pharmacies because they're legally and professionally qualified to do so. So we right-size the amount and the ratio. And on top of that, it's only that we need usherers, right, to like a traffic police to say, hey, you finish station 1, now go to station 2. You finish station 2, go to station 3. So we need a lot of things of that coordination. Otherwise, is the chicken without a head, you know, then they're running around, then they get confused. So that is tweaking number 1. Tweaking number 2 is also like the volume, right? So when we first started, it was 1,002, we know how much we need. Then when we go 800, 900, we can sort of right-size and downsize a bit, right? But now when we go above 3,000, so we have to up the capacity, the doctors, the pharmacies, the nutritionists, and all the usherers even more. And now, from my understanding, the government is going to roll out another few more locations in Klang Valley. One of them is Chuji, another one is also Bukit Jalil itself. So then we have to start planning manpower-wise. Hey, they're going to do this in 2 weeks' time. So if they're going to do this in 2 weeks' time, what is the plan? We're going to top up additional 10 more doctors, 20 more pharmacies, 10 more nurses. So we have to right-size and get the amount right. And of course, I'm not going to lie, at the first, we might not be correctly, completely, but we will keep improving from time to time.
Right. Chevy, thank you so much for shedding some light into the matter and for speaking with us tonight. Appreciate your time.
Thank you.
After this, we're going to take a look at the potential impact of a lockdown on the medical manufacturing supply chain. So stay tuned to consider this.
Welcome home.
Are you ready?
Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. What is being done to ensure that there will be minimal impact of any lockdown to stakeholders within the ecosystem of the vaccination process? I mean, this includes the essential medical device manufacturing industry and others in the supply chain. Let's speak now to Andy Lee. He's the chairman of the Association of Malaysian Medical Industries. He's also Johnson & Johnson's Government Affairs Director for Malaysia and Singapore. Andy, good evening. Thank you for joining us on the show. Now, there seems to be many moving parts to the medical device supply chain. I mean, everything from disposables to surgical instruments to therapeutics to diagnostic equipment. I'm wondering just how well insulated this industry is to the risk of manufacturing disruption. I mean, what are the consequences, you would say, of disruption to operations within this industry?
Hi, Melisa. Thank you for having me on this show. So I've been introduced as the chairman of AMI. We are the Medical Device Association for Malaysia. Just to give you a bit of understanding of how big the medical device industry in Malaysia is really, we are a high growth healthcare subsector, and we are really expected to re-energize the Malaysian economy landscape, right? With production of high complexity, high technology, and high value added products, right? But Malaysia today, we comprise about 200 over manufacturers, right? Producing broad range, like what you mentioned, from the disposable, the surgical gloves, opticals, and of course it goes into very, very complex surgical instruments, implants, clinical devices, and of course healthcare equipments, diagnostics, right, which has electronic modules in it, right? So when you look at the spectrum of how MCO, how the COVID pandemic has actually impacted the whole sector, if you put in perspective, like Malaysia is the biggest exporter for catheters, right? Not many people know that. It's about 80% supply to the world market of catheters, right? We know about rubber gloves, but the bigger chunk of that medical device consumables, we are big, right? But we have also got very high range, high tech medical devices manufacturers here in Malaysia. Now, when the pandemic hit and the lockdown hit us in March last year, obviously we were learning from ground zero. What can we do? The government is closing borders. Every country around the world is closing borders, right? We see today containers are a problem, right? Shipping is a problem, but slowly we have gone through that process over a year, right? But every time when there is a lockdown, we always communicate with the government, and MITI has been very, very helpful for us in this sector. They've been very transparent. They've been listening to us. What are the pain points that we are facing? Not just at the
Andy,
manufacturing side.
Sorry, if I can
right.
Right. So if I can interrupt, just to say, so considering how strategic it is both to the management of the pandemic locally and globally, perhaps regionally, and to the local economy, do you expect that in any plan for a lockdown, full, half, whatever the measure might be, that there'll be a carve out for the medical industries, that they will not have a problem in terms of continuing production?
Right. So in that point, we are always seen as what we call a critical essential sector, right? Today, we've got hundreds of hospitals in Malaysia. They need to operate. They need to continue to serve Malaysians. And, your medical devices in there someone has to deliver, and someone has to go through the whole supply chain. Now, when we look through the issues of manufacturing site itself, right, it's self-contained. You have got sites with 300, 600, 1,000 employees, and they are in a very high, what I call sanitized area, right? I'm speaking about the real surgical equipments, surgical catheters, manufacturing of those equipments, right? And the lockdown And when we spoke to the ministry and the government, they do understand, right? There are some restrictions, and of course, at the start of the pandemic, all the SOPs has already put in place.
Could I just get you to elaborate on that? Because as we know, factories and manufacturing hubs, they contribute one of the highest number of cases and clusters. How can we avoid that, particularly if we're talking about essential services like medical device manufacturing? How do we think about that, making sure that they don't contribute to more COVID cases?
Yeah, so it's a tricky question to answer, because it's the manufacturing sites are not self-contained, right? The workers go home. There is a social life of the employees, but what we have always made sure, right, at the industry level, is adherence to strict SOPs. When you enter the site, strict checks on temperature, social distancing. Barriers are put in place when you have meals. Even having said that, there will be 1 or 2 incidents, right, when patients, or rather employees, are contracted with COVID-19 in their household or in the community areas, right? And that's where we try to stop.
Yeah, Andy, I just want to ask you, because Khairy Jamaluddin Mosti, Minister, suggested that with some of the facilities for bottling vaccines, they might actually be rolling out the vaccinations for the workers in those.
Yes.
And I know that AMMI has already called for prioritization of stakeholders within the ecosystem for vaccination. What response have you got from that call?
We have been involved in some discussions with the Ministry of International Trade. They are putting together a pilot program for industry vaccination. There is some sort of what I call priority in very strategic manufacturing sectors, right? As you can see, pharma area is one, right? We are happy to see that rolling out. We are also very cognizant about the supply of vaccine coming into the country, right? Repeatedly, YB Khairy Jamaluddin has mentioned many times that the supply is coming in, right? In weeks, in the coming weeks, we have also seen millions of supply is planned. And today, in the news, AstraZeneca's vaccine has arrived. About 600,000.
Any update on the government stand on the single-dose Johnson & Johnson vaccine?
Well, YB Khairy has answered that question, and it's something which we cannot deliver to fit into the national vaccination program. So in a sense, in fact, today the supply of vaccine in Malaysia is ample. Right? It's all about delivery schedules, right? Every country around the world is facing the same problem, right? So I'm very pleased to also see the number of doses are coming. Even like yesterday, the vaccination has ramped up to about 80,000 being administered, and is due to go up higher, right? So with this opportunity, we see a few pronged approach, right? One is, we have already encouraged our member companies' employees, right, take opportunity when AstraZeneca is rolled out. First come, first serve. They are going to Penang. It's one of the big hubs for medical devices. Johor is also one. Klang Valley has already started, right? So as more vaccine, after the allocation of 60 and above, it's open to all. The 1.1 million doses are sufficient.
So encouraging the workforce to get vaccinated as soon as possible. Andy, thank you so much for joining us on the show tonight. Appreciate your insights and your time. Thank you. We're going to take a quick break here on Consider This, but more in just a couple of minutes, so stay tuned. Don't go anywhere.
Anda boring waktu-waktu macam ni? Tak ada cerita nak tengok?
Remisa!
Hujan pula tu.
Saya nak nak bagi tahu satu rahsia. Ini rahsianya. Astro Ultra Box. Kalau dah upgrade, anda dapat sehingga 60,000 video on demand. Hujan pun tak ada hal. Astro Ultra Box ni lain macam. Boleh play dari mula tau. Tak sempat nak tengok semua awesome shows Record je. Dengan Wi-Fi, Astro Ultra Box boleh record semua. Awesome kan? Dah Ultra ke belum?
Mei ini, ikuti detik-detik terhebat di Sports Bank.
Take my breath away, Top Gun.
Oh, that is beautiful.
This score is just so fascinating.
The win. Kesemua 51 perlawanan UEFA Euro 2020 secara langsung dalam 4K UHD. Percuma untuk pelanggan Sportsbank. Dan anda berpeluang untuk memenangi TV 4K.
Let the party begin.
Langgani Sportsbank di saluran 200.
Thanks so much for staying with Sharaad and I on Consider This. Now, if you've just joined us, we're discussing the potential impact of a full-scale lockdown on the healthcare system. The question we're asking tonight is whether breaking the chain of transmission will be enough without increasing healthcare capacity. One of the concerns that we have is what's being done to increase healthcare capacity and how quickly can we do it, right, Sharaad?
Yeah, and we've just had the two guests that we've had on have explained that. I think largely that a full lockdown is not going to impact, one, the vaccination rollout, and two, the ecosystem on which a vaccination rollout, and in fact larger healthcare issues depend on, right? So what we heard of, this is new to me, how big the medical industries are in supplying not just Malaysian needs, but also global needs.
Yes, catheters, 80% we supply worldwide, something I didn't know. I was very aware about the rubber gloves industries, but catheters not so much. Definitely for sure. Now, we're going to be speaking to the president of the Association of Private Hospitals Malaysia, Datuk Dr. Kuljit Singh, in just a couple of minutes, but mainly to find out whether or not the healthcare industry is going to beef up its resources, whether there's capacity there. And I understand that we have him on the line, Dr. Kuljit Singh, President of the Association of Private Hospitals Malaysia. Dr. Kuljit, thank you for joining us. Always a pleasure to have you on the show. And if I may begin our conversation with a statement made by the Health Ministry yesterday, urging private hospitals to increase the number of beds to treat COVID-19 patients. I'm wondering whether private hospitals have the capacity to do so.
Well, private hospitals, we have started treating COVID patients since January. And we have capacity constraint, not in terms of just space, but also the doctors that are able to treat COVID-19 with their staff. It is not the same like what you have in a public hospital where you have medical officers, house officers. Treating a COVID patient is not just housing a patient on bed and then looking after them twice a day. Patients in category 3, 4, and 5, it's around-the-clock work where you need a team to manage these patients. So in private hospitals, we are able to do it, but we are constrained with space in terms of manpower, and it was not easy to expand as much as what the government can do.
Kuljit, this is a pandemic that's been with us for more than a year now. Was there a feeling a year ago that, in fact, private hospitals and indeed the public health system would have to ramp up the staffing of hospitals, doctors, nurses, auxiliary staff, and was that planning done a year ago?
I think on the private hospital side, we were not in the loop in treating COVID because the entire 2020, COVID was managed exclusively by the public hospitals. We only got into this treating of COVID patients early this year because there were many patients who wanted to get private healthcare, private treatment for COVID. Only for that purpose, private hospitals were roped in the beginning part of this year to help those patients who wanted private healthcare. Not exactly to assist the government because we do not have, as I mentioned earlier, we don't have that kind of capacity or that kind of level to even make a big significant difference in the numbers that we have. So, but I think the government has planned it out well last year, and I think they did anticipate that this may happen. In fact, last year we provided 75 ventilators from the private sector to the public hospitals to expand their services. So I think they were pretty much ready. But whether are they ready for the 6,000 number, 7,000, and it may go even higher, that we are not sure whether the readiness is up to that level.
Can I ask you, Dr. Kuljit, about the impact to non-COVID-19 patients? DG Hisham had recently said that elective surgeries and procedures in public hospitals around Klang Valley will be reduced or postponed to ensure that there'll be more resources for COVID-19 patients. What about in private hospitals? Is there an impact to non-COVID-19 patients?
Okay, in the private hospital, we still treat non-COVID patients, maybe in slightly reduced manner. But because a lot of private hospitals are not treating COVID in a big number, so we still have a lot of capacity to treat the non-COVID. So we have made a proposal to the government, and the government has agreed that we can take over some of the non-COVID electives from the government hospitals to the private sector, which will be funded by the government. So there are patients in the public sector who have been waiting to be treated for the last 1 year, for example, and their dates have been postponed because there's no capacity to treat them there. We in private hospitals, we are willing to take over these patients and treat them so that they don't have to wait any longer. Proposals are there, the circulars are there, even the budget is there, made ready by the Ministry of Health for this purpose.
Right.
Kuljit, could you help us understand if communications and strategic planning between the private sector and the government has improved over the last year? Are you seeing better communications and coordination?
I think as we have gone along, and particularly in this year, I think the communication and our dealings and also our discussion in the Ministry of Health has increased tremendously. We almost meet on a weekly basis. In fact, in this week itself, we have met them 3 times online in Selangor, talking to the healthcare providers in the public sector, and we are actually working very closely, especially in Selangor, because that's where our highest number of patients are. So in fact, today morning we had maybe the second or third discussion with them, trying to sort out how we are going to manage the surge of patients and how we are going to share our resources. So yes, not just with the public sector, even between the private hospitals, we are communicating with each other much better. Though we could be competitors, we may be from different groups. But I think the cooperation has been tremendous at every level.
Well, glad to hear that. Dr. Kuljit, always a pleasure speaking with you. Thank you for joining us on the show tonight.
You're welcome.
That's all we have for you on this episode of Consider This. Thank you so much for watching. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
We will be back with you same time on Monday. Till then, have a great weekend, folks. Good night.
Good night.